Well, while Paul gets the PowerPoint presentation set up, I'll just explain a little bit about my background. And first of all, let me thank you all for inviting me back to speak here. I think it's probably 20 years since I last spoke at one of these gatherings, so, you know, a bit greyer. And my name's Geoffrey Montague-Smith, and I'm an osteopath. And I've got a practice in Tunbridge Wells in Kent, and also in Harley Street one day a week in central London. And when I started in practice in Sevenoaks, my then boss, a chap called Richard Pitcairn-Knowles, was invited to speak about Down syndrome at one of the talks, and he wasn't really very good at public speaking, so he insisted that I went and gave the talk on his behalf. And as a result of that, I started seeing an awful lot of babies in the clinic, and the observations that I was making started to concur with some of the observations of other colleagues. And I'll be talking a little bit about the findings and what we do in terms of treatment. Osteopathy isn't just about backs and discs, which is what a lot of people think. It's very much a holistic alternative or complementary medicine which takes into account all of our lifestyle choices. So yes, structurally we're working on our patients, but we're also interested in how much they're exercising, how they are in terms of their nutritional status, and I'll be touching a little bit on this as we go, because there's a lot of value there in terms of overall health and well-being. Can everybody hear me? Okay. So the osteopathic management of Down syndrome patients. First of all, osteopathic medicine, as I said, is a sort of holistic medicine, but primarily we're interested in three main areas. We have the biomechanical components, where we're looking at how the bones are moving, how the joints are working, muscles, ligaments, tendons, fascia. And if we have restriction and stiffness in the body, or if we have stress points or old trauma points, it's going to compromise the flow of blood, the flow of lymph, and the nervous system is going to be compromised. There are going to be altered signals from those tissues that are not working properly. There can be hormonal factors which don't work, so the endocrine system gets disrupted. So with treatment, we can go a lot further than just relieving pain and taking people out of stiffness. So it's important to realise that structure governs function. Now, the other aspect that we're interested in, and this is really key to the work with our Down syndrome patients, is the biorhythmic component. So yes, we have the mechanics, and we need to make sure the mechanical body is working, but what sits underneath that are these very subtle rhythms, particularly the craniosacral rhythm. And this is a rhythm where the skull is moving constantly. I'll show you how this works in a moment, together with the sacrum, which is the tailbone. And that's driven by the respiratory rhythms and other deeper body rhythms. So we have this constant ebb and flow in the body, tied into the biorhythms, and when that rhythm gets disturbed, it can have consequences into the system as a whole. So we have the respiratory motor, which is the driving force really behind these biorhythms. This is the breathing apparatus. The diaphragm is constantly pumping the tissues, and even when we're at rest in bed at night, we've got movement. So if you wake up in the morning really stiff, or if after a long car journey you're really stiff in the body, it's because you don't have enough of this biorhythmic movement in the body. There will be something that has locked the craniosacral mechanism, and that needs to be released. The other thing we can talk about here is myofascial memory, because quite often old trauma, not just physical trauma, but even emotional trauma, can get stored in the tissues of the body, particularly the fascia, the connective tissues. And this is where old whiplash injuries and old accidents kind of haunt us forever, because we have the trauma, and the fascia receives the trauma, and it kind of locks in, and that's where these rhythms can be utilised to release those patterns. Third area that we're interested in is the bioenergetic arena, where we're talking about the flow through the meridian system, and we have the energy centres of the body, which are called chakras, and there's a biofield around the body, and all of this is validated now. It's not sort of mumbo-jumbo. It's very much a real force at work. The life force, the vital force flowing through the body is dependent on a free flow of this bioenergetic process. And that's where we start to get into the measurement of the meridian system using electroacupuncture. If you Google EAV, you'll be able to find out more about that. Our website, the clinic website, has information on this. And then we get into the human energy field and working, as I said, off the body. There are ways of measuring how that's working as well. For those of you, I'm recording this talk. The PowerPoint slides will be made available via email if you're interested, so don't worry about keeping notes and remembering everything. We'll be able to get an MP3 file of what I've said to you, and then you'll be able to look at things in a bit more detail when you've got the time for that. So there's the spine. You can see the axial column. Here's the sacrum at the very base. That's the foundation stone for the rest of the spine. You can see here the sacrum, and then the 5 lumbar vertebrae, 12 thoracic vertebrae, and 7 cervical vertebrae. And the segmental joints, as we sort of go through each segment, it's important that the spinal column is working properly, and that there's a free flow between each of the segments. And that's where osteopathic treatment really originated, in chiropractic, I guess, in the sense of working on the spine and making sure that's optimised. Here you can see, typically we're known for dealing with prolapse discs. This is where the intervertebral disc starts to bulge and press on a nerve. Here you can see a scan picture of the disc bulging backwards. Now the reason I show you that is because quite often with our Downs patients we're going to see tension developing as they get older around the base of the neck, and it's a particular weak point for where the neck meets the thorax, and we quite often see disc bulges in that area. Now the reason that we get a disc bulge is because of increasing stress on the disc, and it's quite often due to compression in that area, which is fundamentally due to a lack of movement through that part of the rhythms stop working. We get congestion and then compression in the tissues, and then it's under pressure. So I'll show you how that works in a moment. There's the pelvis, and it's the foundation really for the rest of the structure. We need to have a level pelvis, so we'll often examine the patient standing and then sitting, and we'll make sure that the pelvic bones are not in a twist or a torque, because if we get a torque in the pelvis, then it throws the rest of the spine off. That's called a scoliosis, and that can have an impact on what's happening through the rest of the axial column and up into the cranium. So we're really interested to make sure that we're level just here. And here you can see the musculature. We're going to go through the different layers. So taking each layer, this is the more superficial or surface layer, and then we go back into the middle layers, and then here you can see the deeper layers of the musculature. And just notice how from the very tailbone, these long strands of muscles are sort of connected right up to the base. And the connective tissues and the fascia are connected literally from top to bottom. So, when we get deeper underneath the more obvious muscle groups, you can see how everything is in communication structurally. And it's important to realise that, you can have a problem here, but it can show up as a disturbance in the base of the spine. What's extremely interesting, and this is really the fundamentals of osteopathic medicine when it began historically, was that if there are disturbances in the spinal column, you can see all the different nerves and the sympathetic ganglia coming away from the spine. They connect with each of the main systems of the body. So neurologically, we have what's called a viscerosomatic reflex, which means there's a connection between the soma, or the structure, and the organ on the inside. So if we have a problem in the middle of the thorax, it can affect cardiac function, it can affect digestion. So, you might have a stomach acid problem and an ulcer in the stomach, and it would come back to a problem in the T4 and 5 area, the 4th and the 5th thoracic vertebra. So, yes, we need to take the medicines to deal with the condition, but we should also have an eye on what's going on structurally. So it's quite important to know that there's a connection there. So if we now start to look at the cranium, which is the core sort of focal point for what we need to talk about today, this is the adult cranium. And what you'll notice is that we have the vault of the cranium and the large orbits where the eyes are, and then you can see the very large sort of facial structures with the mandible and the maxillary bones. And when we go to the side picture here, I just want you to notice the little sutures. These are joints through here. Can you see these little cracks? Can we see all right with the lights on? Is that okay? Now these cracks are there for a reason, because the skull, we were all taught that the skull is a solid box to protect the brain and it doesn't move. And that's not actually true. These joints are present. Anywhere where there's a joint in the body, it's because there's meant to be movement. Okay? So there was a man called William Garner Sutherland who in the mid-1900s, I think it was around 1940, he started to ask the question, why are these joints there? He was in the Osteopathic school in Kirksville, and they had a disarticulated skull in a display cabinet there. So the bones were mounted to show how they fitted together, so it's like an exploded skull, if you can imagine that. And his question, from an engineering sort of perspective, was why on earth are these joints there if the whole thing's meant to be stuck together? And he then started to experiment on himself, and he made apparatus that he would go to bed with a leather harness with screw points on, and he would stop the movement in certain areas and then see what would happen. And he started to put forward the idea that there was a mechanical movement in the skull, and that if it didn't move properly, there would be health consequences. So that was the start of cranial osteopathy. And of course now we see not just osteopaths practicing the cranial work, but also the chiropractors and the physiotherapists are starting to understand this more and more as well now. So the word is out. When I, just as an aside, when I started working on babies when I first graduated, we had doctors locally actively discouraging parents from bringing their children because they said it was dangerous. Now we see a lot of referrals from midwives and health visitors and doctors because, 20 years on, it's pretty much standard practice in our area now, because we've done this for a long time, for parents just to bring their babies for a check just after birth, just to make sure everything's okay. So things have really shifted in this short space of time. Now, if there's one thing you remember today, this needs to be the thing you remember. There is a membrane called the falx cerebri. Okay, this is a large piece of connective tissue in the brain. It basically, in the skull, it divides the two halves of the skull in two. And it stops the brain from rattling side to side. So it acts as a support structure within the skull. And it's connected up with another membrane, which I'll show you in a minute, called the tentorium. Now, this membrane, when we deal with patients with Down syndrome, is where the problem is. That's where the tension is in the cranium. And I haven't worked out why that membrane gets tight, but it does. And what it does is it exerts a pull from the front to the back in this direction, so we get a stress through the cranial base. The pituitary gland sits right in here. That's the master hormone gland, growth hormone, and all the other master hormones come from that gland. When this tightens up, it will stop the development of the cranium from being normal. And it will actually, now we know that most of the problems that we see with the Downs babies, they basically start, the developmental process gets blocked kind of after birth. There's something that happens. They're not born with the cranium misshapen. It sort of happens as they develop. And that was the key thing, to realise what can we do to actually look at that factor. And you'll see as I go forward that it explains an awful lot of what we see anatomically as the children develop and progress and grow. So that's the falx membrane, and there's the pull that is exerted through that. And here we can see the tentorium, which is the membrane that acts as a floor for the brain, and it's connected up to the falx at this point here. And when that membrane gets tight, it affects the movement through the side of the head, and it stops the temporal bones from moving freely, and that's where the ear structures are. So we'll find out why that's so important as we go forward. But a lot of glue ear and a lot of problems in terms of drainage through the middle and inner ear structures are to do with the fact that that membrane is tense. Here's an infant cranium, newborn. You can see the fontanelle, and you can see the large gaps between the bones. The bones of the skull ossify from certain key points, and it's a bit like lilies on a pond. The vault of the cranium starts off in membrane, and then the bone sort of grows through the membrane. And so it starts from these points, and then the bone grows inwards, and eventually the suture will disappear, the fontanelle will close up. But the suture in Down's children, very often in the front, remains patent for quite a long time. And there's a reason why that happens, in my opinion, and that is because we have this restriction of movement. It's almost as if the skull is trying to maintain what movement it can by keeping that suture patent for longer, so it stays open. And here we see it from the back. Here's the occiput. You can see again the joints. And the arrows here indicate the tendency for the cranium to spread outwards. So we get parietal eminences, and we get a shortening of the cranium front to back as the babies develop. And because of the tension in and around the falx membrane that anchors here and runs backwards, we get a blockage of development in the facial area. And this is really what causes the shortening of the palate and the maldevelopment of the sinuses and the tension that shows up in the face. You'll notice, if you refer back to the adult cranium, do you remember how big the adult cranium was around the face? That with the neonatal skull, there's very little, it's mostly about the vault, and you can see the eyes, the orbits, and then you can see the mandible and the maxillary structures are really underdeveloped at this point. So most of the growth actually in the cranium occurs in the face. And as we grow, that's where the majority of the growth is. So if there's a restriction in the hub of the cranium that stops that growth process, you can imagine how we're going to get problems in the nasopharynx and in the oral cavity. And this is illustrating that, if there's a tendency for there to be a block through the cranium, we get this effect where the face doesn't grow outwards properly, as it would do as we reach adulthood. And normally by the age of 12, that's starting to have had its full effect. I'm hoping that, I don't know how I'm going to click that to get that animation working. Thanks, Paul. So, can we turn the lights off, do you think, so we can see that a little more easily? This just illustrates the respiratory movement. Can you see that okay? Is that better? Yeah. There are 3 diaphragms in the body. There's the pelvic floor, the main respiratory diaphragm in the rib cage, and then the tentorium, which I told you about. Now, they all move in harmony, so the breath is driving this movement through those 3 diaphragms. And here you can see the long axial column, the spinal column, and a rather macabre representation of what goes on in the cranium. But here are all the sutures of the cranium, the joints, and you can see an exploded view and how it all links together. And there is movement in the skull. And we've got patients in their 80s who still have sutures that are working. It's palpable, you can feel it. So it doesn't, yes, it fuses, but in some patients it stays patent for a very, very long time. And these patients are healthy because they have this movement. So here you can see the occipital bone and the sacral bone and how they're moving in harmony with each breath. So imagine the diaphragm here driving this movement and all the connective tissues that connect through to the pelvis and up from the upper rib cage into the base of the neck. And what's happening is with each breath, there's a movement into what we call flexion and extension, inhalation, exhalation. And everything in the universe is about the expansion and then the relaxation again. It's all about that. And that's what the body's doing constantly, expanding and then relaxing. If those movements get blocked, then we get compromised function. So just from a structural point of view, you can understand how if you have a blockage in the pelvis, you can end up with a headache. And here you can see the lumbosacral complex and the importance of the movement through this axis. And that's why if this gets jammed up, if you fall on your backside and you have an accident, snowboarding or something, and you shock this area and it stops moving, you're going to lose the movement through the lower discs. They won't get nourished properly, they're going to start to deteriorate, and that's when you get your disc trouble. And the same is true for any other area of the spine. Now here we can see the cranium moving. With each breath you can see the expansion phase where it widens side to side and it decreases in its diameter from front to back. Here you can see the movement. Now that is your typical falx tension, that phase there. Did you see what happened? Okay, so this position here is where we get stuck. So we get a pulling in of the cranium. So we get a shortening of the axis front to back, a widening of the head side to side, and that's typical of what we see. Here you can see the brain, the ebb and flow movements through the brain, the neural tissue, the blood in, the venous blood out, the lymph, it's all dependent on this movement. So if we don't have the movement, we're going to have compromised neurological function, compromised neuroendocrine, hormonal function. So this is really a very important concept to get your head round. Now this looks at the specifics of the cranial base. You can see the sphenoid bone and how it's moving in relationship to the occiput. The pituitary gland sits right in this area here. Again, that's the master gland. All the precursor signalling hormones are produced from this area. They'll stimulate the thyroid, they'll stimulate the adrenals, the sex hormones. And if this movement is compromised, here it is in a bit more detail, it's going to cause a problem. Now, in a Downs patient, we've got it locked in this position here. So it's short front to back. And what happens is the palate shortens, which is down here, as a result. And we'll go into that in a bit more detail in a moment. Here you can see the connection with the ethmoid bone just behind the nose. This is a bone called the vomer, which sits just above the roof of the mouth. So the roof of the mouth is here. So when we get into this phase, you can see how that would shorten front to back. Draw a line here, and you can see how that would shorten. That's what happens in the palate, because the bone is stuck in flexion. Does everybody get that? Yeah. This is why dummies are good. If you actually get a baby sucking on a dummy, it pumps that cranial base. Yes. If you breathe in, if you go to a yoga class, the first thing they'll do is lie you on the floor, you put your hands on your diaphragm and teach you to breathe from the diaphragm. And there are muscles connected to the diaphragm that go down into the pelvis, particularly psoas, which is the stitch muscle, it's the hip flexor. And then there are muscles in the upper thorax, which link to the upper ribs that go up through the root of the neck into the cranial base. So anytime the rib cage is moving, and anytime the diaphragm is working, you've got movement going down into the pelvis and up into the cranium. And that's what drives that craniosacral movement. And then it's a musculo-fascial movement, yeah. And then there's a deeper rhythm in the brain itself, where we've described the idea of the brain expanding and contracting. So there's then a deeper rhythm at work as well. And it's possible to feel these rhythms. So you've got the rhythm of the breath, you've got the rhythm of the neural tissue actually working as well. Yeah, we put our hands on the cranium very gently, and you can feel where the bones are moving, where they're not moving. It takes a bit of practice, but yeah, that's easy. Can we get to the next slide? So we were just seeing the video of this, but this is a still, and essentially what we're describing is a membrane that runs front to back through the cranium. It has an impact on the cranial base. It pulls the cranium in, so the antero-posterior diameter becomes shorter. So we end up with a head that's kind of short front to back and wider side to side. That's in a nutshell what we're seeing. Okay? So we get this widening of the cranium side to side because it shortens front to back. And of course the facial structures, as I said, don't develop. Any other questions? Yes. 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 Yeah. Well, we'll talk about that in a moment. There's, yeah. And here we can see what will happen with the temporal bones. We get a flaring of the temporal bones in, as the head widens. We get jaw TMJ problems, which is a bit of a problem with the dental aspect. I mean, we're getting into technicalities here, but what you need to know is that as the temporal bones get locked, the eustachian tube, it's like a hose pipe, okay, and it runs from the middle ear down into the throat, and that hose pipe is dependent on movement. We need to be going in and out, and that hose pipe is then pumped. So we've got this movement constantly through the tube, and that's what drains the gunk from the ear into the throat. Now, if you've got it all stuck, the tube fills up. I mean, they're anatomically smaller anyway, we know that. But the tube fills up, and then you've got otitis media, and glue ear, and grommets. I mean, there's there's a bigger conversation around that. But the first thing we can do with the babies, if we keep the cranium moving, it's possible to keep the temporal bones working, to keep the connective tissues in the cranium functioning correctly. Anatomically, you approach a more normal situation, and you can drain the sinuses and the nasopharynx, the ears, so the ENT situation becomes very much improved. And then, of course, you don't need the antibiotics, which is a major, major problem, which we'll talk about as we go. So, good question. You've asked about the flattening of the head. So this brachycephaly and plagiocephaly, look, we're seeing that in all babies now. You know, there's this back to sleep campaign where you know, they're saying put the baby on the back for cot death. Not a good idea. Because if you just put the baby on its back all the time, you're going to end up with moulding of the cranium. And just so you know, if you see moulding of the cranium, where the cranium is, so there's this inherent movement in the cranium for it to expand and contract constantly. If that movement is absent, and you're putting the baby in the same position all the time, you will see moulding. If the movement is present, you won't see moulding, because there's enough movement internally to stop the head from flattening. So a flat head, or, you know, plagiocephaly, where it's all distorted on one side, so it's flat on one side and, you know, bulging on the other, that is a sign that the cranium is not moving properly. And then you need to take the baby for an assessment. They put these helmets on babies now. I think it's much nicer just to go and get the mechanism released so it stays well from within, rather than sort of, you know, using helmets to try and get the cranium to mould. So, yes, the baby needs to be on their back, but when they're having naps and when you're around, you can put them on their side, use a couple of pillows, so that different parts of the cranium are being pressured at different times. Babies, when they're born, regardless of the baby, will come through the birth canal with a talk. They'll be as when they're born. Quite often the birth trauma and the shock gets locked in. They'll have a favourite side that they go to. They'll want to feed from one side more easily than the other. And as they lie on that side, if there's a compromised cranial mechanism, you're going to see flattening on one side of the head. So it's important that the parents are alerted to the fact that they need to be carrying the baby to encourage it to look out that way and to turn the head, and then, you know, they put on the side in that direction, and it just gets easier for everybody. Down syndrome features. I mean, you know, you guys probably know all about this stuff, but I'll talk about this a little bit from the osteopathic perspective now, so that we can discuss. So the hyperflexibility, we see very lax ligaments in the body generally, and this is a particular concern when we get to the atlantoaxial instability. Now, if you're taking, you know, patients with Down syndrome can have a ligamentous laxity in the top of the neck. And osteopaths who are doing this work need to know that we mustn't be manipulating the neck at the very top level with standard osteopathic. So make sure, if you're going to see an osteopath, that it's somebody who understands. First of all, they need to be doing the cranial work, absolutely, and they mustn't be just go and see a cranial osteopath. It's not easy. So we see a muscular hypotonia, where the muscle tone is not quite what it should be. Now, of course, we need to exercise, we want to try and stimulate the system, we want to get the parasympathetic, sympathetic balance working. Exercise is absolutely key. I do believe that if the neurological system is balanced properly, if the cranium is working and the brain is inherently more healthy because of this inherent movement and a balance through the autonomic system that comes with that, we're going to see an improvement, and it's going to be easier to find that balance and see the tissues stay closer to normal. We discussed the protruding tongue and the mouth breathing. You know, look, if the face isn't developing properly, if you've got a shortened axis in the palate and the tongue is protruding, because it's not a big tongue, we know it's not a big tongue, it's just a short space, a smaller space for the tongue to be in. And if the ears aren't moving, all the lymphatics are congested, you're going to get mouth breathing, you're going to get ENT congestion, and everything that goes with that. It's also then a focal point for infection, because there's no movement there. That's exactly what we see, time and time again. There's a question. Oh, I'm sorry. So we were just talking about a flat head. That's what that is. Plagiocephaly is when you get a flat head, but it's kind of off-centre, and you see bulges. There was a little girl I saw some years ago who, she was called Ilana, and I'm not kidding, her head was so flat front to back. It was wider than it was front to back, so she had more width in her head than she had front to back. There was no movement in her mechanism, and the parents had been talking to cosmetic surgeons about doing surgery to try and fix this situation. And I explained all of this to them. I said, give me 2 years. We got the mechanism moving. I wish I had photographs, because I should probably track her down and get the photos. But she didn't need the surgery. The parents, the doctors were stunned at how much the diameter of the cranium came back to normal. She was still young. She was still, I think, 3 when we started. There's tremendous scope for the inherent, natural kind of urge from within the body to be normal. You just have to mobilise the system, give it the help that it needs. So these flat heads, just get the mechanism moving and the body will do the rest. It's a bit like getting a child going on a swing. Give them a push and you wait for them to get the hang of it and you step back and it will slow down a bit, you go back in again, you do another treatment. Yes, yes. It does. With development and growth, the connective tissues as we grow, sometimes in a rapid growth phase, particularly in the puberty time, we've got rapid growth happening, and the connective tissues, if there's a tendency for it to be tight, will re-tighten. So you then need to do more intensive treatment. You might see them once every 2 or 3 months. Just short treatments, 15 minutes is enough, just to keep the cranium and the fascia loose. And that's true of any child, lots of teenagers are going to get headaches and tummy aches as they go through rapid growth, growing pains, and they respond really well. And that's no different to the babies that have, inverted commas, colic. It's the same thing. They're going through a rapid growth, so the connective tissues are tight and they just need a little bit of help. And once it's moving, exercise, correct breath, general health and well-being strategies. We'll talk a little bit about what we do dietary-wise and so forth in a moment, but that's what keeps everything working nicely. Flat nasal bridge, that's all part and parcel of this tendency for the head to be short, front to back. We're talking about the neurological loss of hearing. That's a big issue where, hearing aids are required. But as I say, for me, if we got the otitis media, the sinusitis and the pharyngitis, if that's kept to a minimum because we've got the movement through the system, then that's obviously going to help hearing. At school won't be so troublesome because, it'll all be clear. And this is true of any child, and we're seeing children in the clinic, who've had, by the age of 18 months, they've already had 10, 15 courses of antibiotics. The snotty, grotty, chesty, disaster. Lots of reasons why that's happening. So we've got the airways resistance. Here we've got the GIT stuff, the gastrointestinal factors. We've got a little bit of reflux very often. That's often because of a tight diaphragm. When the diaphragm tightens up, the sphincter, which is called the cardiac sphincter, can actually open up, so you end up with reflux. And lots of babies get this, but basically as they grow rapidly, there's tension in there, it needs to be released, the diaphragm needs to be relaxed, and then the sphincter can work properly. You don't get the reflux back up into the esophagus. We see a tendency for celiac disease where the little hairs, the villi on the gut wall, get damaged. I've got a slide which shows that in a moment. We're seeing more and more of these kind of problems just in the general population for lots of reasons. But it's often quite a good idea if there's failure to thrive to check for celiac factors, so the paediatricians will normally be looking for that. We see the atrial and ventricular septal defects where there are miscommunication points within the heart. I think that might come from the vagus nerve in utero. There's a nerve that sort of informs the heart. There's a whole sort of developmental process which can be linked to vagal function. So it governs 2/3 of the gut. It governs a lot of the cardiac factors. And this nerve passes through the cranial base. So particularly as we develop, we need the vagus nerve to be free and working properly. And if anyone asks you how do cranial osteopaths deal with colic, gut dysfunction in babies, it's really by releasing the cranium, getting the shock out of the cranial base, and it frees the vagus nerve. The nerve supply to the gut is then more normal. So that's how that works. The dental problems, delayed, and teeth come in all directions, it's crowding, I mean it can be a disaster. If you go back to the understanding of as this face is trying to develop, and as the germ cells for everything are trying to develop, if it's restricted and held back, the flow and the signalling for the development of the teeth and everything that is to do with the nasopharynx and the mouth and the oral cavity is going to be compromised. So as soon as we get this all moving, we see much better dentition in the children that have had treatment quite regularly. There's the suture. We talked about the frontal suture that stays open for longer. And then the underdeveloped maxillae. This is to do with the dental factor. The maxillae of the bones is the upper jaw. That's underdeveloped. Any questions on that? I mean, these are just the general features that we see. I'll read this to you. A colleague of mine, Nicholas Handel, if any of you have friends in the West Country, and if you need someone who can help you in this regard in the West Country, Nick Handel has, we're all finding the same things. And he wrote this really quite well. It's a bit difficult to read, so I'll read it for you. It's been shown that hypoxemia, particularly during the first few years of life, has a bearing on the subsequent degeneration of the dendrites and axonal plexus of the neurons in the central nervous system, and that this contributes to the development of neurodevelopmental delay, neurobehavioural difficulties, or even premature death. Now he's basically saying there that if this whole cranial mechanism isn't moving properly, we get a lack of oxygen, and blood supply obviously carries the oxygen to the brain, and that's why we can start to see brain development impaired. Now, babies that come, particularly if they come in the school years, they're in school, they may be 4, 5, 6 years of age, and we start treatment, the teachers will come back to the parents and say, what have you done? They'll see differences, they'll see cognition improve. It can be really interesting. And that's true of lots of children who have difficulties, the ADD, autistic, Asperger's kind of spectrum. I mean, this cranial work will have an impact in many different spheres, working with paediatrics and with children. So it's also been shown that one of the effects of the decreased buffering against disordered development for environmental forces due to trisomy 21 is a delay in the development of the face. This is what I've been speaking about. Particularly the maxillary bones, which can retain fetal-like proportions. Remember I told you it needs to come out like this, and if it gets held back, it's a problem. And the malalignment or the maldevelopment of the major facial sinuses. Clinical experience suggests that this is associated with an increased mechanical tension of the somatic tissues of the face and neurocranium, which is not found in the normal population. This is thought to involve the anterior pole of the falx cerebri. That's the membrane I showed you. The front bit of that membrane is where the tension is. And this effect is known to osteopaths as a compression. It is speculated that chromosome-induced reduction in buffering leading to maldevelopment of the face and facial sinuses may lead either completely or in part to the mechanical effects of the compression involving the falx cerebri and somatic tissues of the face. An osteopath trained in this field should be able to prevent or reduce maldevelopment of the face and facial sinuses in the Down syndrome neonate, provided appropriate treatment is commenced soon after birth, and that's the key. This should allow fluids and mucus to drain effectively from the facial sinuses, preventing infection, blockage, epithelial, hyperemia, and enlarged adenoids and tonsils. Better oxygenation should take place to allow the cortical neurons to develop. That's brain development, brain tissue. This simple measure alone could reduce the neurodevelopmental delay so common in Down's children, and the longer run the child may be able to attend normal schools, develop normally within the community, and possibly eventually become an independent human being, able to fend for him or herself in the community, even able to earn their own living. It is anticipated that osteopathic treatment should be administered as appropriate for the first 18 months of life. That's when we're in the key stages here, the babe in arms stage. Have any of you heard of Joseph Chilton Pearce? cracking the cosmic egg. Look up Joseph Chilton, he's a child development specialist, and he talks about the first 18 months. Remarkable man, talking about the development of children and what we have to do as parents to make sure that all goes well. He's written some excellent books. Joseph Chilton Pearce. So the 18 months of life when the sinuses are beginning to form, and therefore whenever the sinuses become congested, so thereafter, whenever the sinuses become congested, they really should be treated. What I suggest is whenever there's a cold or a blockage where they've gone through an infection process, it'll often just retighten things. So what we do is we suggest a quick checkup to make sure that we unlock everything again afterwards. On that note, if there's fever in the body, what's the first thing we do when a child gets a temperature? Right. Why do we do that? Why do we bring the temperature down? It's dangerous. That's what we're told, isn't it? It is dangerous if it gets too high. But the body produces a temperature. If we get a hypothermic reaction, the body temperature goes up because the germs can't survive in a hot body. So the immune system has less to do if the body is kept hot. If we bring the temperature down, the germ divides and the white cells of the immune system can't overwhelm the germ. So the infection goes on and on and on. It lasts much longer. If you keep the temperature safely high, not dangerously high, we don't want to get into febrile convulsions, you will actually find that the immune system has a lot less to do. So what we should try and do is concentrate on less Calpol, even the homeopathic remedies like belladonna and gelsenium and the ones that will bring the temperature down. You're still doing suppressive medicine, even though you've used a natural medicine. So a lot of paediatricians now are saying that we should let the temperatures run because there'll be a shorter course of illness. And quite often, if you do this in the early stages, you won't need the antibiotic treatments. And we have to avoid antibiotics at all costs. And I'll tell you why in a moment. Hope I don't run over, there's a lot to say. Okay, so basically we're saying that if we do the work early, we can save an awful lot of time and money and healthcare costs, and it's just a good thing all round. It is speculated that by reducing the compression in the region of the sphenoid and the frontal sinuses, appropriate treatment may have the effect of reducing the depression at the bridge of the nose, perhaps the dominant facial deviation of the human being with trisomy 21. In summary, evidence is presented to support the proposal that much of the handicap of Down syndrome is not due directly to the chromosomal defect, but to impaired postnatal development as a result of hypoxemia from upper airway obstruction. It is proposed that appropriate treatment from birth given by suitably trained osteopaths can offer a safe, non-invasive and effective means of maintaining a patent airway. It is postulated that this will reduce some of the severe and widespread disabilities which handicap the individual with trisomy 21. It's a sort of a foundational health issue. The fact that the development of the face, the sinuses, the airways, the nasopharynx is compromised, and then it's the knock-on effect of that. That's what we're describing. Are there any questions on that aspect? Structure into function from that perspective? Because I want to talk a little bit now about the gut.
How much can you have an effect on those if you haven't done the intervention in the first 18 months?
It's more difficult. The sphenoid, the base of the sphenoid starts to really firm up around about the age of 12 when the face really begins to develop through. It's never too late to do treatment because you can still get an effect through the vault because the joints are still working. The sooner we start, the better, frankly. If you have, look, the postnatal problem starts day one. So the message should be, the diagnosis happens, everyone's in shock, you don't know what to do, where do you go, it's tough. And the thing is, what we need to do is try and get the message out to say that the paediatric osteopath can have a place in the care of that baby, not just from what we can do cranially, but also from the advice that we can give relative to other health factors, which is what I want to cover now, because there's so much more than just the cranial work. it's really important to understand that, you know, the physiology of the body is affected by not just what's going on in the cranium, but by what's happening elsewhere. And I want to talk a little bit now about the gut. Who's heard of the GAPS protocol? Good. Okay. So, here we are, you know, Hippocrates, back in the day, said all diseases begin in the gut. And this is crucial. And there is an epidemic of disease these days because most people don't have a healthy digestive system. It's really a problem. So, GAPS syndrome basically establishes a connection between the state of the gut and the health of the rest of the body. Now, I'll just explain a little bit about GAPS. There was a neurologist, a Russian lady called Natasha Campbell-McBride, who had an autistic son, and she was looking for a way to help him, and she reversed his autism by changing his diet and fixing and healing and sealing his gut. And her thesis was, if the gut is not well, if things are getting through from the gut that shouldn't be, if there's toxicity in the gut, those neurotoxins, because there's a connection between the brain and the gut brain, if you have toxicity in the gut, it can cause a toxic brain. And she's right. And we could get into really controversial areas here, but Wakefield, the MMR guy, has talked about gut health and brain toxins. This is where this whole thing is going, and it will come much more to the surface as we go further. But there's something afoot, and there's a smoking gun, and you guys need to research it. Basically, gut flora, which are the bacteria in the gut, make up 90% of all cells and genetic material in the body. So we're more bacteria than we are human, which is kind of an interesting thought. So the gut flora is made up of 100 trillion bacteria in 3 groups. They make up the microbiome. You can Google microbiome and you can read all about this. We've got the essential or beneficial flora, which are meant to be there. We've got the opportunistic ones, which are there but shouldn't be dominant, and they will become dominant if our immune system becomes compromised. And we've got the transitional flora, which sort of come and go. So they should just be in and then out again. So we eat them, they get past the stomach acids, they find their way into the gut, but they're overwhelmed by the good bacteria that are present, and then they're gone again. They leave no trace. The gut flora protect us from invaders, as I just described. They keep the gut healthy, and the integrity of the gut wall is maintained by these good bacteria. They help with digestion and absorption. They produce vitamins. A lot of people don't know that the gut flora produce our B vitamins. Don't take a B complex supplement. Get good bacteria, and they'll make their B vitamin factory. It aids detoxification, and actually 70% of the immune system is gut modulated. There's a tissue called GALT, gut-associated lymph tissue. 70% of our immunity is gut modulated. If our guts are not good, we're going to get infection after infection after infection. What damages the gut flora? Well, the biggest thing for you guys is going to be this. Because too many of our children have had multiple courses of antibiotics. And it's a real problem. We've got, in the general population, things like pharmaceutical drugs, stress, poor diet, processed foods, I say multiple infections, disease processes generally. Bottle feeding, unfortunately, if we feed our babies from a bottle, we're going to have consequences. We're going to see often intolerances showing up now to cows' products, cow's milk. Because if you're going to feed from a bottle, make sure it's an organic formula. Try and rotate them. Look at nanny goat's formula as well. Mix it up a little bit. The body is supposed to get food in varying, different signatures are meant to come in. If we constantly feed our baby with the same formula from meal to meal to meal to meal, don't be surprised if, 3-4 months down the line you're getting a gut inflammation because it's just been too much of the same thing. A little of what you fancy does you good. Variety is the spice of life. These are healthy villi. So this is your hairy little finger-like protrusion on the gut wall. And these little creatures here, these little cells, are called enterocytes. And we've got these little hairs on the enterocyte. And essentially, here's the villus. So this is the birth unit for the enterocyte. And it basically goes up to the top of the villi, and then it decides not to be an enterocyte anymore and goes off into the kingdom of angel enterocytes. That is a healthy gut. There's this constant flow of enterocytes, and they've got little hairs on them, which basically help with the digestion, the digestive enzyme process. This here's a nice healthy with a smiley face enterocyte, and this is what's allowing the nutrition into the body. And here's a sick enterocyte who's really not healthy because he hasn't got the bacteria to support him, he hasn't got the right pH in the gut, and yada, yada, yada. It just goes wrong in the digestive tract. So a damaged gut wall will give us a lack of protection of the beneficial bacteria. We're going to be under attack by pathogenic microbes and toxins. This is the toxic gut. How many of you know children who've got ADD, ADHD, epileptic, seizures? Right, so if you look at the gut-associated psychology syndrome, GAPS, you're going to be able to understand why a lot of these patterns are in some way gut modulated. And you can take patients who have got neurotoxins and you can tidy up the gut and you can fix a great deal of those kind of problems. So as the enterocytes degenerate, the tight junctions between the cells open up, and then we end up with food particles getting through the gut wall that shouldn't, and that leads to allergies and intolerances. So our membrane that should only allow certain things through starts to fracture and open up, and then we get problems. So the damaged gut will let toxins through, they get into the bloodstream, and then we get an immune response which leads to autoimmunity and, most importantly, inflammation. And inflammation is the enemy. So, when we deliver our baby, if we deliver the baby vaginally, the first thing that happens is that baby gets mummy's bacteria. So we inoculate the child with the vaginal flora. Now what happens if mummy's had antibiotics, or if she's not fed herself properly, or if she's getting thrush regularly? You know, the first thing that happens is the baby gets an inoculation of dodgy bacteria. And a lot of the babies we see with colic and those kind of digestive disturbances haven't had the right hit from mummy at the point of birth. And if there are antibiotics introduced at the time of birth or shortly afterwards, it destroys the normal gut flora. So we have to pay special attention to making sure the baby gets the right inoculation. If they haven't, then we need to be using the right protocols to get the gut flora balanced up. So the baby gets abnormal gut flora, the immune system is compromised, then we get the ear infections, chest infections, and the circular round of antibiotic treatments to try and get on top of the illnesses. Each time you have the antibiotics, you get further damage to the gut flora and the immune system struggles even more. So it's an ever-decreasing circle. So that's why I said antibiotics have to be avoided. This is why. So it just creates a more and more toxic situation. And then we introduce the vaccinations, quite often into a baby that has already got a compromised immune system because of these factors. I'm not going to go into this because we're running short of time. Just understand that the toxins, the microbes and the undigested food get through the gut wall. The toxins get in to the bloodstream, and then we have a brain that is toxic. And we have to do everything to avoid that. So we have the structural component to our work, but we also have the naturopathic component, which is keep the body as healthy as possible from the standpoint of digestion and from the standpoint of avoiding medications that will destroy the natural integrity and immunity. A lot of disease is to do with inflammation. As we take this further and we have gut dysbiosis, a leaky gut, an inflammatory response, immune response in the body that gets out of hand, these are the sort of things that are going to turn up as a result. And we all know people that have got that issue. Hippocrates was right. Good health starts in the gut, primary. Vitamins, you've probably all read the research on vitamins, it's not that great. Actually, we all thought it would be a really good idea to take lots of vitamins. The research doesn't bear up that it does as much good at all. It's very good in short bursts. If you have a specific deficiency and you run an IV of magnesium or vitamin C, it can be very, very helpful. But as a general thing, it's not really as helpful as we thought it would be. So it's been a bit of a disappointment. So back in the 70s, this was a Time article that said, new research that shows that vitamins may help cancer and, fight AIDS. It doesn't work. What works is whole food. If you eat a good diet, and if you're going to supplement the diet, if you can't actually get your sort of, 5 to 13 servings of fruit, vegetables and berries every single day, then you need to look for whole food supplementation. The one that we use in our clinic, I've got some samples on the back, the chewables for the kids. I've left some packets there for you to look at. But basically, if you look at whole food supplementation versus laboratory produced supplements, it stacks up much, much better. Because we've got phytonutrients, we've got the whole food in the supplement, not just the vitamin and the mineral. Okay? It's really important that there's the enzyme and phytonutrient balance. A lot of people turn to juicing. It's a big craze at the moment. Everyone's doing their juices. The problem with juices is the fructose. So if you've got sugars in the juice, it feeds the yeast in the gut, and then we get the bloating and the problems in that way. So we work with this product where they basically took the water away from the juice and ended up with an encapsulated product. Here's an apple. So if you've got your vitamins in your pot, it cannot replace what is in, this is what's in an apple. Okay? So you can see all the different phytochemicals and components. So it's better to take the apple and eat it rather than take the vitamin. If you can't eat the apple, take the juice of the apple. And if you can't take the juice of the apple, then this company that we have, the product range we use, they've dried the juice and put it in a capsule. So it's really very straightforward. It's called Juice Plus. This is what's in it. When you get these slides, you'll be able to look at this a little bit more. Basically, fruits, vegetables and berries. The children's product is a chewable, and it's a really neat way. My kids have all used it. We take this stuff at home, and it's a really neat way of topping up the deficient modern diet, actually. And the company will give the child's product for free if the grown-up is taking the product. So it's a way of getting the product for free for your child. So try them and see what you think. This is what's in them. Lots of lactobacillus, you can see, for the probiotic factors. But basically fruit powders with the sugar removed. They're the vegetables. Again, lactobacillus, spirulina, all sorts of great algae there, antioxidant algae. And here in the berry blend, we've got coenzyme Q10 and all sorts of grapeseed extract, all antioxidant, all very, very helpful. So it bridges the gap. So if you've got, we had some of these. My kids at home used to sit and look at vegetables like that. It wasn't easy. And actually using the chewables, what they find is that if you bring the chewables into the diet, it actually starts to gain a certain, it's almost like the receptivity to the real food starts to open up somehow. So that's kind of really interesting. This is a product that is double-blind research internationally. You can't argue with the clinical research, peer-reviewed journals. You can check this out in your own time. It's the most researched nutritional product out there. So this is why a lot of clinicians are recommending it now. And interestingly, Europe are just about to ban, well, there's going to be a safe limit legislation on vitamins and minerals. So basically what you're buying in Holland and Barrett right now, you're not going to be able to get in a few years' time. They cannot stop a whole food supplement. It's a much better way to do it anyway, but it's food, so they can't muck with it. Because Europe are trying to take our homeopathy away, they're taking our herbs away, they're taking our supplements away. Because they don't want you getting natural medicine, they want you going to big pharma for the solution. Cynically, that's what's going on. So the recommendations. I like to introduce cranial osteopathy day one, really early. Literally as soon as you're out of the hospital. Okay? Probiotic, gastrointestinal support. I've told you all the reasons why that's so important. Let the fever run, and you won't need the antibiotics. Keep it safe, but let the fever run. Whole food supplementation. We've spoken about that. There's the website. If you go to that link, you can see here there's a page where you can order, but they've got all the the science, everything up there. You can look at that. So we use the Juice Plus product. I like to use vitamin D spray because we know that the majority of the population are vitamin D deficient. All expectant mothers should be taking 5,000 international units a day. Babies, we give this to, particularly in the winter. If you're taking your children out into the sunshine, let them tan safely. Don't use factor 50 straight away. Let them make their vitamin D. Vitamin D deficiency will lead to rickets, we know, but the other thing that goes with rickets is upper respiratory tract infection. What do we see in our children at epidemic levels these days? Upper respiratory tract infection. Vitamin D will also help with asthma. It'll help with all sorts of autoimmune problems. Fibromyalgia patients, measure their blood, they're vitamin D deficient. So, we have a vitamin D spray available through the clinic. It also has vitamin K in it, so that keeps it safe, keeps the calcium in the bones. Don't take vitamin D without vitamin K. There's a fermented fish oil there, which is great for the kids. It tastes horrible. Who got given cod liver oil when they were a kid on a spoon? Why don't we do that anymore? This is a fermented cod liver oil from the States. It's how the Eskimos would take the fish livers, put them in a bucket and let them hum. And then the oil will come off. And basically that is the best fish oil, I think. I take it, my kids have it. There's a syringe. You literally hold them down. Like Grandma used to do. Yeah, so you can give them a little sweet chewable afterwards. You do the oil and then you do the chewable. And here's the probiotic. It's fluorosyntropy. Now, what you need to know about this probiotic is it's a spore. It's called Lactobacillus sporogenes, or Bacillus coagulans. Now, there are lots of probiotics out there. Most of them don't survive the harsh environment of the stomach. The stomach is acidic for a reason. It kills the bugs that are on our food. So you've got to pour a ton of these probiotics in to actually get them past the stomach acid. As a spore form, this will go past the stomach acid and past the bile salts, and then it divides in the gut. And it's got fructooligosaccharides in there which feed the good bacteria that are already present. There is another one that we don't use as much. It's called Simprove. It again will survive the stomach acids. It's very expensive though. This works out much cheaper. Simprove can be an expensive thing, but it's a liquid one. It tastes of mango. It's lovely, but it's much more expensive. So as a cost issue, we prefer this one. No, actually, if you have a course of antibiotics, you can take this while you're on the antibiotic, and you can break the capsules open and give it to the babies. It's a powder, and we give it to newborns. So if there's any sense of an antibiotic history in mum's pregnancy, or with the colicky babies, this just works wonders with infant colic. I mean, infant colic is mostly dysbiosis, actually, and growth-related pains. Yeah, I mean that will help because the immunity in the gut will be supported, but we've got other remedies. If you felt a cold coming, we've got other herbal stuff that we would use for that, but that should stop colds coming. And if you do get a cold, it's not a cold, it's a cleanse. So we just want to let it out, let the toxins out. So yeah, there's the vitamin D spray. And here, the other thing you can do, the fermented fish oils I showed you, but Red 23, if you go to this website, you can buy sauerkraut from them, which is basically real sauerkraut. So when you pop the lid, it goes and it bubbles. Well, the liquid is the most probiotic food you can get. So you can make your own sauerkraut in a crock, and if you want to get good beneficial bacteria into your digestive system, then use fermented foods, like we used to in the old days. We've got far too much processed food in our diet now, really. If we go to the supermarket, we've got 2 aisles of real food and then 16 aisles of crap. My mum used to go from the butcher to the baker to the fishmonger to the vegetable guy, and then she'd go home and make real food. I love my mum. She was the best mum in the whole world. She's the worst mother-in-law in the whole world. She's the best mum in the whole world. So, you know, that basically in a nutshell is how we view the situation. So we're looking at osteopathic technique for sure, but there's a whole naturopathic aspect that has to be taken into consideration as well. And we're dealing with, you know, brain health and the health and well-being of children that are compromised at a certain level. But if we understand what to do mechanically and from the standpoint of what we can do naturopathically, we can support these children and just any child really, really well. That's our perspective. And I think that's all I need to say at this point. So thank you very much for having me today. I hope that's been of some interest. I'm going to hang around now. I think we're going to have a coffee in a moment, but if you've got any questions, I mean, we've covered a few questions. Has anybody got any
general questions now, or would you like to just have a chat and have a coffee? Yeah? I don't know about you, but I mean, that's absolutely fascinating. We sort of expected, I think, a lot of head massage and so on. And I said, the education days are really hard work. I think that was a bit hard on our heads, I have to say, but actually once we wade through it, there's an awful lot there. And thanks so much for the information on the slides. You know, we'll send those out to you as well. If you want to email in, happily forward that to you. There's an awful lot in there.
Yeah.
Huge amount, more than just what you might expect. Gosh, I wish I'd listened even better than the first time we met.
Well, I'll send the MP3 file across to you.
That's great.
So you can make that available to everyone.
A matter of interest, I mean, how much of this has developed even since we first met?
Well, when we first met, I was really focusing just on what we could do osteopathically with the cranial work. The other stuff has come through many, many years of working naturopathically as an osteopath and developing. We've got testing modalities now using EAV, and the understanding now in terms of the interrelationship and the integrated osteopathic medicine that we're now doing is way, way ahead of what it was, you know, when we first met. So yeah, it's changed a lot.
I mean, fantastic development in natural treatment across the board.
And there's just one thing I need to add. A lot of you might be concerned about bringing babies for osteopathic treatment because you think we might sort of squeeze and massage and hurt. It's so gentle. It's literally the lightest touch, and we're just feeling, it's like following the child on the swing. You literally feel the movement and you keep your hand on them and you give them a gentle nudge in the right direction. It's really, really low impact, and they love it. The children love it. So there's no danger. The GP back then, when he said don't send your child, it's dangerous, they don't know because we haven't had the time to explain this to them. And if we invite them into a room to talk to them, they don't come. So it's safe.
We have 2 little ones there, Geoffrey, if anybody, if the mum is willing to use this to sort of gently show.
Well, I'd rather not do that outside of a clinical situation because obviously, you know, it needs to be... but what I would encourage you to do is look in your local area and find a paediatric osteopath who you can see, because it does require a certain amount of regular treatment. In our clinic, we do the initial intake, which is about £60 because we need to go through the whole history and look at the whole family health story. But then the follow-up appointments, we do them for £10. So it's really low cost. And it doesn't need more than 15 minutes, so we run a really low-cost baby clinic. But, you know, it's got to be someone in your area, really, because you're going to be going, you know, quite regularly in the early days if you've got a newborn.
My son's had treatment, so we know something quite around here.
Excellent, yes.
Okay, we better leave it there.
Thank you.
Geoffrey, we've got a small gift. Thank you.
Oh.
Thank you very much indeed.
Thank you very much.
And,
that's very kind, thank you.
Absolutely fascinating. Thanks very much, Nick.
Thank you, sir. Thanks.